For years now, doctors, nurses, and patients have been complaining about California's healthcare system.
Last month, Governor Arnold Schwarzenegger and elected leaders said they'd come up with a plan that would overhaul the system and make it work for more people. The News 10's Karen Massie says that plan may now be on the critical list. Karen?
A crowd of critics has emerged, all complaining about the same thing. They say the measure will cost the state money that it does not have. They also say if the health care plan is approved, high costs could hurt the very people it's supposed to help.
Does this one hurt you more than the other?
Yeah.
The numbers are frightening. 6.5 million Californians do not have health insurance.
That makes access to health care a right and not a privilege.
Assembly Speaker Fabian Nunez claims the health care reform bill he's backing will fix California's broken health care system.
If passed by the Senate, 71% of Californians, 5.1 million uninsured, most of whom are low income, are working class individuals and their families, will no longer be uninsured.
What you have before you, Madam Chair and members, would create one of the largest programs in state government.
But legislative analyst Elizabeth Hill says the deal will only make California's financial difficulties worse.
Now looking 5 years out to 2014, 2015, expenditures in that case would exceed revenues in the fund by $1.5 billion.
Those numbers have critics seeing red.
Individuals are going to bear a big piece of the cost for health insurance.
Jerry Flanagan with the Foundation for Taxpayer and Consumer Rights says the measure forces employers to buy health insurance for workers or contribute to a state insurance pool. But people who don't get coverage through their jobs become the new uninsured.
California families are required to buy health insurance, and insurance companies can charge whatever they choose. And if you don't buy, you face a fine.
Unions representing thousands of California workers are also hurling criticisms.
This is a hoax on Californians, and we believe that they should really know the truth.
Opposition is growing so loud now that supporters hope they can get enough lawmakers on their side before the Senate Health Committee takes a vote on Monday. A whole host of trade and worker unions oppose the health care reform bill, and State Senator Leland Yee says he can't support the measure either, meaning it could be one vote short of getting out of the committee and onto the Senate floor on Monday. So it could mean back to the drawing board if state lawmakers are going to have any chance of getting the measure before voters on the November ballot. Back to you.
All right. Thank you very much, Karen. 2007 was supposed to be the year for health care reform, but votes on the issue kept being backburnered. Today, Governor Schwarzenegger said he is very optimistic that after some lively debate on the issue, health care reform will be passed.
And what I try to do is to take on issues that are very complicated issues, very controversial issues, and issues that people have attempted to try to solve, but they couldn't. So we are back. We are trying to do something that the rest of the country has not been able to do. I think that we are able to do it in this state.
The governor hopes to put the plan before voters in November.
A review of the governor's proposed health care package is scathing, especially given the budget deficit the state's already facing. Now, here's a breakdown of legislative analyst Elizabeth Hill's reports. In a best-case scenario, the plan's revenues would cover the costs in just the first year of the program. But by the fifth year, Hill estimates annual costs would actually exceed revenues by about $300 million. And if premiums were to exceed the estimated $250 per person by just 50 years, the deficit could actually reach $4 billion by the fifth year of the program.